the center. And today we are doing a case of old aural hematoma that has made uh, the ear bit complicated. As you can see, there is a bump. So I think the hematoma or the blood clot is presented over here, or maybe some mass. And of course, the blood clot is here. So we'll have to manage this two way. First, I'll uh, do an incision over here and see what is coming out, and then I'll do suturing over this side to correct the hematoma. So let's see how thing goes. So I'll first, this is a sterile kidney tray, इसको ऐसे लगा लो, and I'll give a small unique incision over here. So yes, this is also a hematoma. बाहर से लो. So this is, you can see a clear serosanguinous fluid, so more like a serum. So this is a hematoma as well. What I'll do is I'll take a gauge piece in a tincture iodine, and I'll try to debride the lining of the wound inside. So tincture है, give tincture. So this case was presented to me 10 or maybe more days back. I suggested them to go for surgery, but owner was not ready for the surgery at that time. And then today it is presented to us, and now it is a bit complicated, as this dog might have done a pawing of this area as well and developed a large hematoma in this aspect. So in this area there is a lot of bleeding, as the major vessels supply are on the dorsal aspect of the ear canal. See the clot coming up. So now I'll flush this with lignocaine and adrenaline combination. So I can check some of the capillary bleeding that is going on. And I'll let this for healing by second intention, because we have got a lot of muscles in this area, so that will heal nicely. We need not to do any suturing of this area. All we have to do is we have to take care of this wound. We need to do a regular dressing. Lignocaine and adrenaline. स्टेराइल सिरिंज दे दो उसको स्टेराइल सिरिंज दे दो we'll keep watch piece over here and put some pressure bandage for the time being till my lignocaine fortified with adrenaline is ready. So I'll be injecting the surrounding areas. What I'll do is I'll take a gauge piece and I'll simply cover this up. And I'll leave this as such and I'll start with my hematoma surgery from this side, and at the end I'll again look at this one how it's going. So here we have got a large hematoma at the base of a ear. So my approach towards doing the oral hematoma procedure is I'll give a neck incision to remove the serum out, and then I'll do a stitching from periphery and coming towards the center of the incision. Another thing that I do is I don't go full thickness suturing from here to here and then coming back. So basically the serum is accumulated at this part, and the ear pinna is like having a cartilage between. So this is one part and this is another part. So the serum is accumulated over this part. So I'll just when I'm giving my bite sutures, I'll just go through the cartilage and come back rather going to the full thickness and then coming in. So I'll show you in a moment. So incision. So as it is a long-standing case, so you can see the fluid is coming out from this side as well. Okay, so now what I'll do is the hematoma here is actually resolved. So I'll start suturing it, and then I'll leave this side to heal by second intention. Okay, so can I have 30 polyamide, please? So here we are. I'm using a 30 polyamide in a cutting needle, reverse cutting needle, and I'll be suturing. So I'll go from skin, cover the cartilage, and then coming back. You can say I'm coming back like this, and my suture is not coming out from the skin. So this is how I give. The advantage of this type of suturing is your ear don't shrink post-operatively, and it gives better healing. Also, while doing a suturing, keep in mind that your suture should not be very tight and should not be very loose as well. So there you are. Okay, so I'll give another. I'll go deep and I'll come down again like this, and there we are, giving a slipping knot. So this is how you have to do this. I'll go again. I will come out from there. So this is a bit boring surgery sometimes, as you have to keep on suturing again and again till you cover the whole ear. So as the hematoma here is already resolved, I'm not following the pattern where I'll go with the periphery and then come to the center of the incision, because the incision over there is actually drained the serum accumulated at this side as well. So I will simply suture it in a regular fashion like this. I have plugged this ear canal with the gauge piece just to make sure that no fluid or no serum goes inside while I have a cut. I'll remove that after surgery. So again, to show you the suturing, I have gone through this skin, cover the cartilage from outside. My suture is not coming through and through from this side, and my needle is coming again back from here, and I will give a suture. I'll do a knot just to cover this part of skin with cartilage. The idea behind is to press the loose skin with cartilage so that it gets stick to it, and in 7 days time, and then I will remove the sutures, and I'm not giving these sutures very tight, they're all loose sutures. While doing the knot, uh, you can see my attendant is pressing the lower surface with his finger so that ease me in giving a knot, and it also helps to prevent shrinkage. This is how I go it for aural hematoma. You can encounter bleeding because already there is a cellulitis in this area on the other side. So this is really important that you should ask your attendant to place his fingers inside and lift the ear pinna a bit up while you are giving the knot, otherwise there will be a shrinkage. So there it is. As this is a infected wound, कट इट ये थोड़ा छोटा हो गया, यहाँ से कर दो, यहाँ से इसको भी काटो. As it is an infected wound, so I am taking a bit larger bites. Is giving more skin to skin contact or more contact area for healing tissues. Okay. काटना नीचे से इधर से. Can I have another switcher, please? This is how I've covered almost half the area of hematoma. You have to do that again. this is how we have covered almost all the area where hematoma was there. Hmm. So see, this is how my attendant is lifting the ear pinna for me when I'm giving a knot. So this is more important. If you do this, your ear will not shrink post surgery, and you have to be careful that your knot should not be very tight. So I think I've almost covered the part of hematoma. This part was okay. This part was not swollen or having serum inside. But as it is an infected wound, I will also put some sutures on this good side so that it may not turn. So see, here it is. I'm going inside, covering the cartilage, then coming back. My suture is not coming through and through from this side. So this is a key. If you do it like this, and then while giving a knot, asking your attendant to put a finger beneath and lift it up. So this will help to reduce the shrinkage of. So as this is a good side, I'm just giving few sutures only. Hmm. So here it is. Because इसको आवाज दो 30 के लिए उसको आवाज दे दो गंगा को आवाज दे दो गंगा गंगा Just waiting for my sutures to come in. इसको से लगाओ, ऐसे हाथ में लगाओ. So I think I have done with the suturing of this inner side. I'll try to find if I can put some more sutures. I can put one suture over here.
एक महीने से लगभग नाइट टाइम से उसको कॉल के बीच बीच में करती है और 6 साल की है, कभी बच्चे नहीं दिए, पानी बहुत ज़्यादा पीती है, तो ब्लड टेस्ट कराया है, एक्सरे भी कर लिया है, तो टेम्परेचर 103.7 तो अभी एंटीबायोटिक में क्या कुछ दूँ या
एंड्रोफ्लॉक्सिसिन. So I think we have covered almost every part, and till down here. So you can see none of my sutures are coming through and through from this side. I will take out this and now there is no bleeding. So I'll leave this part of wound to heal by second intention. I'll put some mega heal ointment inside and cover it with a gauze for now, and then I'll give routine antibiotics and anti-inflammatories for next 1 month, 1 week, and so this is it. The corrosion ointment दे दो, Stephen. Stephen दे दो. Yes. So just can I have another gauze, please. So I'm putting this for today only. Tomorrow, when the stock come for dressing, I'll remove this. And this is it. So we have done the procedure. We have drained the hematoma here, and we have covered the full ear with, you can say, intradermal sutures covering the cartilage. So this is it, and thanks for watching, and I will try to live stream some good procedures soon. So please take care of yourselves and take care. Good night.